Hello guys, welcome back to my channel Ages Kingdom. And in this topic, I'm going to discuss about different kinds of rating scales and several times asked questions for 5 marks, and it is very important also. So rating scale, the word itself is saying it to express. It is also one of the psychosocial analysis only, mostly using for qualitative type of feelings expressions or towards an object or towards a person. So rating is a term used to express the opinion or judgment regarding some performance of a person, object, or a situation or a character. A rating scale is a tool in which one person simply checks another person level of performance. This is some usually in BS nursing college levels when you're presenting a seminar or a lesson plan or you're presenting a what teaching. We have some structured scales, so that scales will easily help you to evaluate a other person's performance in a different situation or in a different scenario. A rating scale could be a 3 point, 5 point, 7 point, and even more also. So when you see, this is always a structured one. Scales are there means it's always structured one. It can be set up by individual, or sometimes it can be developed by individual researchers. So here when you see, the types of rating scales are graphic rating scales, descriptive rating scales, numerical rating scales, and comparative rating scales. The word itself is saying graphic. So it's a graphical presentation. Rating skills will be there. Descriptive means when you are explaining or describing about a person or an event or a situation or an object. And numerical numbering rating scales will be there. And comparative, it is trying to compare with two products, or it is trying to compare with uh, pregnant versus non-pregnant, or antenatal versus postnatal. So like that, some type of rating scales will be there. So we'll see how graphic rating scales will be there. So best example is Likert scale. So graphic rating scale is the simplest and most popular method for appraising a performance. And in this scale, the performance is printed horizontally at various points from the lowest to highest. It's a graphic rating scale is a Likert scale example. So when you see, when you want to show about the level from a higher level to lower level, to what extent staffness participate in clinical conferences. So occasionally, frequently, always, or seldom, or never. So like that, if you say that's a graphic rating scales. And descriptive rating scales means it will speak about level of clinical performance, and it will speak about some other methods also. This type of rating scales does not use number but divide the assessment into series of verbal phrases to indicate the level of performance. So example, judge the level of performance of using personnel in medical ICU. So two three concepts will be there, and they will speak about descriptive rating scales. Then numerical rating scales means the visual analog scale or semantic differential scale, which I have already explained. When you speak about pain scale, so it is giving numerical itself is a meaning numbering. So here the scale is speaking about based on the number only. If they say severe pain, how much? If they say one number, what is the category, like that. And comparative rating scale, in this type of rating scale, the researcher makes a judgment about an attribute of a person by comparing it with that of another person. And advantages of rating scales are, it is already sometimes structured scales, so I think it is easy to administer for any people, and even researcher can collect huge information regarding an individual or an object. So like it can be used for large number of subjects, easy to administer and score, efficient and economical in terms of time and money, and helps to reduce unreliability, and it is used to evaluate the performance and skills. And disadvantages are like difficult to fix up rating about many aspects of the individual, and misuse can be there in user because it is a structured statement. So suppose there is no scope for explaining further of their thoughts or ideas. So this is all about rating scales, and it is several times asked question for 5 marks. So if you really like my class, please do subscribe, and this content is enough to write for 5 marks.